Expired ingredients, stale bread, mislabeled food. Yes, we're going to talk about it yet again. And this time, the kitchen under the scanner is inside a hospital. You heard that right. A Karnataka Food Safety and Drug Administration crackdown has raised fresh questions about the food being served to patients, attendants, and the hospital staff. During an inspection at the canteen at Apollo Hospital in Bengaluru, officials reportedly found expired rava, icing sugar, maida, bakery products. They also seized stale bread, expired packets of mixture and pani, puri, baking soda. Inspectors additionally flagged 2 plastic chopping boards, saying their use could pose bacterial contamination risks, and identified several misbranded food products. But this was not an isolated hospital inspection. It was part of a 3-day food safety enforcement drive across Bengaluru, covering 60 3-star and 5-star hotels. Officials collected 77 food samples for laboratory testing and reported violations ranging from expired products and poor storage to unhygienic preparation areas, fungal growth in vegetables, and the use of banned artificial colors. We've highlighted some of that in the past as well. But the hospital kitchen coming under the crackdown lens is something we just couldn't ignore. The numbers from the crackdown are significant as well. Authorities say they've seized 640 kilos of mislabeled food products, 270 plus kilos of rotten vegetables, 45 liters of expired milk and curd, 12 kilos of expired bakery products, 49 liters of used cooking oil. Other establishments also faced action, including notices and sealing of outlets over alleged food safety violations. Now, there is an important distinction here. An inspection finding is not automatically proof that contaminated food was served to a consumer. We're not saying that. Some of these findings will have to go through sampling, laboratory analysis, and prescribed adjudication process. But the concern is quote-unquote obvious. If expired or improperly stored ingredients are found in commercial kitchens, what does that mean for food safety? And when the kitchen is inside a hospital canteen, does the threshold for hygiene have to be even higher? There is also the other side of the crackdown. How do authorities ensure that enforcement is rigorous without becoming arbitrary? Are restaurants and canteens being given clear, consistent standards and SOPs? Are inspections followed by meaningful corrective action, or simply fines and headlines is something that we're out here to consume? So to understand this and decode the hospitality in hospital, Chef Vikas Chawla, Ambassador of Millets NutriHub, hospitality consultant with us on the broadcast. Chef, you've been speaking to us yet again. Yeah. You've been doing the job of a food safety educator. Many thanks for that.
Thank you, sir.
This case that's now come to light, of course, hospitality, you can still raise questions. The lobby can look, really swanky, but inside the kitchen, things can go awry. There is the capitalist reflex. There is the SOPs that are, not being followed. The FSSAI rules could be a little bit strong. But when it comes to a hospital, that's where patients go. You have immense surgeries that are taking place. You have people that are dealing with various kinds of bugs in their stomachs. And you have chopping boards that have or could have bacterial infection. The list goes long and hard. What's your opinion here, Chef Chawla?
Okay, so thank you so much. So in hospitality, there is a risk of such kind of thing, expiry foods and adulterations to the kids and the elderly people. But in hospital, it's 10,000% more to the all kind of age, the all age group, you can say, because they are already fighting with the diseases. And not only the patients, I would say the attendants who are there, even their immunity is also on the lower side when they are attending their patients, whether he's a friend or any relative. So even we should take care of them also, who are the attendants. So patients is already in the red zone. So this is the major difference between hospitality. But again, I found that there is a lack of training, even in hospitals and then in the hospitality industry. Last time also we discussed, there are 2 things the hospitality industry also facing. That is the people are working under wages, and then the lack of training. If we appoint good people on the good scale and we keep on doing their trainings every 15 days like I do in my projects as a consultant also. Similarly, in the hospitals, we need to train them every 7th or 8th day.
Yeah.
Before starting their shift every Monday, they should get a 1 hour or 2 hour session, because hospitals are again in the red line, you can say, if you talk about the hygiene standards and
absolutely
foodborne diseases. So they should take care of the trainings. Training is the must. And another thing I would say, I also consulted one or two hospitals in past also. I discussed to the very depth this study that I recommended them you should not even use refrigeration. अब आप बोलेंगे कि we are in the science world now, we have developed so many things, why we should not keep refrigerators? We should keep refrigerators only for the medicine and for the fruits maximum in the hospital. Food should be prepared fresh, finished, then prepare your evening food again fresh. Why I'm talking about this to remove the refrigeration for the food only, cooked food, because people are not trained. They don't reheat the food well. So that food also bring many diseases and through the bacteria, because they are not able to kill all the bacteria through the cooking. So I think they should remove
These
the
are huge
refrigeration
and
also
massive
in
eye-openers, Chef, that you're bringing to light. I'm here thinking, is it now time, because Apollo is a big brand, and we're not trying to single out, one particular hospital chain. It is a big brand when it comes to, healthcare. So we do need to talk about it. And this is a raid that has, from confirmed and corroborated sources, we've got pictures happened at a Apollo hospital kitchen. Is it time now that these raids happen at other big hospital and healthcare chains also? Because if everybody's attitude is so lackadaisical, for a second we can accept that it's happening at a restaurant, but in a hospital, it's a big no-no.
Yeah, hospital, definitely. I said if hospitality is 100%, we should implement all the systems. Then hospitals are 10,000%, because everyone is with the low immunity over there, even the attendants also. And so they should do the trainings also. Training is fresh food should be prepared like we do at langars or prasad. It should be prepared well and then finished within 3 or 4 hours. Then next food should be prepared again. These 2-3 things, if they implement trainings, the fresh food, no food in the refrigerator even we keep refrigeration in big chains, QSRs, hospitals, and 5-star hotels also. We need refrigeration. But in hospitals, even refrigeration should be completely removed for the food which is going to serve to the patients. We should not use that refrigerated food, because no one can reheat it well. They don't check the temperature when they reheat it again.
And reheating the food also, changes the molecular structure of some of those elements.
It reduces the nutritional value in first time, but who is checking them? They are doing it for the first time, second time. We don't know. Even the reheating, they have to check the temperature has gone.
If you are finding, used oil, inside hospital kitchens, I mean, God knows what else you'll find over there. So again, Chef, we don't want to, create or stir panic in the minds and hearts of the viewers. But since you've worked with some of those hospitals, what are some of those things that need to be flagged, that need to be called out? Things that are general practice, but of course, they're way beyond the red line that we've created.
See, again, I come back to the major point, which is training. There is lack of training everywhere. Even in the 5 stars, they appoint good people through their CVs. They appoint HR, handle it well. They appoint very good people. But again, they're further training. So this is the human nature. We should get training, frequent training we should get. Even when I was general manager for a company in 2010, I disclosed last time also. Then even we used to get training with the MDs and the presidents, also the vice president of the company. We used to get training every month. So it's a human nature. We should get training every maybe monthly we can do. It's a part of that. Otherwise, we can't improve such things, because food is again a serious thing. It's not like selling a kiryana only. It's just putting the food to the gut of the person who is consuming it. So the gut is again the bacteria, good bacteria, microbes. We can't disturb any other people microbes or good bacteria with our food only. We should work. Training is the must. Then refrigeration, we should not keep in the hospital. I will recommend again, because I keep on sending letters to the departments. So these 2 things are main: training and then removal of refrigeration from the hospital, so that they cook food fresh and serve it fresh to the patients.
Whenever I visited, a reputable hospital, there is labeling everywhere. There is a distinguished staircase for the patients. There's a separate elevator for the patients. Everything is spick and span. Everything is very organized. But how difficult is it actually to prevent, this untrained lot at these kitchens from using expired ingredients? Because when we talk about stock rotation, when we talk about labeling, really how difficult is it?
No, no, it's very easy. It's nothing. See, in last month also, I got a chance to train people in the 2 kitchens, and they were not fully trained, but within 2 or 3 weeks now, they are handling my export kitchens even. See, you have to train them. You can train any person.
So what's wrong here, Chef? I mean, if training is so easy, why are we still falling short on that particular front?
I think we are not spending on training. The issue is the people or the hospitals or the management, they are not, I think, agreeing, or they are not spending on training. I think despite of, I think they are having a machine in crore amounts. I think you can calculate the amount, the machines they are using in the hospitals. So it's very small amount, the trainings and all. But not only in hospitals, I'll again say in my industry, in hospitality, restaurants and all, people are not spending on the training, not a single penny. They are not putting any money into the training. They don't care about the kitchen staff. I say it openly on your platform. Even when it comes to the construction of the restaurant, they put all the money into the interiors so that people will come. They put Instagramming photos and all. But when it comes to kitchen, they don't even spend in the exhaust fan also.
It's horrible. It's horrible. It's absolutely shameful. I mean, and there is no dearth of money when it comes to these hospitals. There is no dearth of money. They can spend N number of money. Chef, my final question to you, because you see, sometimes you go to a street hawker, sometimes you want, a roadside Frankie, and you can see the onions getting chopped on some of those boards that should be thrown out like yesterday, but they're still being used. But you still go for it because, well, hey, taste buds also come into play. But everyday hygiene practices versus, when you're inspecting a kitchen, let's say you're going inside and you're inspecting a kitchen, what are the first 5 things that you will essentially look at? Your checklist, Chef Vikas Chawla's checklist.
Okay, first of all, we check the hidden areas only. So we just put our finger on the edges of the corners or in the scatting which is in the down floor. We just put the finger. If dust is there, then it means dust is everywhere. So simple formula is just check the corners with your finger if dust is there or not. Then first of all, just simply go to the dustbins only. You check their dustbins. From the dustbin, you get everything. Even we get 2 things from the dustbins. One is the spoiled food, whether it has been discarded or not. Second, whether the wastage is there or not. Because untrained people do such things that they cut the capsicum, that they put half the capsicum in the dustbin. They don't care about that also. That increases the food cost. So first we go to the edge lining of the kitchens, then we go to the dustbins, then definitely the refrigeration is the next part. And then we see the ventilation of the kitchen is the must. Exhaust and the fresh air. If your exhaust and fresh air input and output is not balanced, like 80% input should be there, then again the bacteria growth will be there in your kitchen because air circulation is not there. Air circulation is the must. And I would say 90%, more than 90% kitchens, they don't care about their exhaust system and the fresh air system. We should take care of such things in the kitchens. This is must.
Okay. Many thanks, Chef Vikas Chawla. Ladies and gentlemen, Chef has been coming to News 9. He's been speaking to us on all these FDA-related and food safety-related things, because if expired food can be found inside a hospital, let alone Apollo hospital, the question is simple. I mean, who is checking what goes onto our plates? Many thanks, Chef. You're doing God's work. Many thanks for speaking to us here again. Chef Vikas Chawla, Ambassador of Millets, NutriHub, Hospitality Consultant, ladies and gentlemen. All right, our final segment on In Your Interest, and this one is really down your alley when it comes to your interest, because Bengaluru may soon put a price, and this might not be just a Bengaluru story, this might become a rubric and a blueprint for the rest of the country to follow. But Bengaluru may soon put a price on something most motorists take for granted: parking on the road outside your own home. The Karnataka government has notified the draft Greater Bengaluru Area Parking Rules 2026, and if implemented, parking on public roads will no longer necessarily be free. Under the proposed system, residents could need an annual parking permit to park outside their homes. The proposed fee ranges from 15,000 rupees to 25,000 rupees depending on the size of the car per year, depending on whether you are driving a sedan or a hatchback or an SUV. 15,000 rupees for small cars, 20,000 rupees for sedans, 25,000 rupees for SUVs. And there is a catch. Not every resident may automatically qualify. The draft says residential parking permits may be issued only to residents whose buildings comply with prescribed parking requirements under the building bylaws. So another one of those grey areas right at the outset. For parking outside the residential areas, the proposed charges are also significant. Cars could pay 40 to 80 rupees an hour depending on the road category, whilst two-wheelers could pay 20 to 40 rupees respectively. Off the street parking would be cheaper, with cars paying 20 to 40 rupees per hour. The larger objective is clear: make road parking expensive, discourage long duration parkings, and push motorists towards organized off-street parking. The draft also proposes higher charges for peak hours and longer parking durations, and it goes beyond just charging motorists. Parking would be prohibited at several locations, including close to signalized junctions, transit points, bus stops, access points to major public transport facilities. The Bengaluru traffic police could also fine, they can tow, they can clamp the vehicles violating the parking rules, and repeat offenders could potentially face license suspension under the applicable motor vehicle provisions. Now, there is a larger question here. Bengaluru has a very real parking problem. It's nothing new. Roads are congested, footpaths are occupied, and public space is increasingly being used for private vehicles. So should parking on public roads come with a price now? The government's argument would be that free parking encourages people to occupy scarce public space indefinitely. But critics could ask, is this really a parking reform or another cost being pushed on to the motorists? And will expensive permits actually reduce congestion or merely make parking unaffordable? And perhaps, most importantly, before the government starts penalizing motorists, will Bengaluru first create enough affordable and accessible alternatives? These are still draft rules that we just mentioned to you. There is a price now for parking even outside your home, but that is also if your residential complex follows the building bylaws. The government has invited objections and suggestions from the public for the next 30 days. So tonight on the broadcast, we're asking the bigger question: can you solve Bengaluru's parking crisis, the congestion, the problems on the footpaths by making parking expensive? Or does the city first need to create more parking? That's the issue at hand. Bengaluru may soon put a price on something most motorists take for granted. And it's not just a Bengaluru problem. We look at it in the national capital. We see the same in all the metropolitans. You name it, Hyderabad, Mumbai. Parking on the road outside your home is something each one of us takes for granted, and that becomes a problem when it comes to traffic decongestion and safety on the roads as well. The Karnataka government has notified its draft GBA, Greater Bengaluru Area Parking Rules 2026, and if these are implemented, because objections have been invited from the public domain for the next 30 days, parking on public roads will no longer necessarily be free on this particular front. So residents could need an annual parking permit to park outside their homes. The proposed fee, again mentioning, ranges from 15,000 rupees to 25,000 rupees per year, depending on the class of vehicle, the size of the vehicle. The division goes as 15,000 rupees for the smaller cars, 20,000 rupees for your sedan type vehicle, and 25,000 rupees for the SUVs. And there is a catch.